Distinguished President of the Hamdard Foundation, Ms. Sadia Rashid, esteemed authorities and participants, students from Hamdard Public School, ladies and gentlemen, Assalamu alaikum and good morning. First of all, thank you for the opportunity to convey WHO's message during this conference. This year, the theme of World Health Day focuses on the health of mothers and newborns. To ensure health for all, any country, including Pakistan, needs healthy mothers and newborns. WHO stands with Pakistan to protect the health of mothers and newborns no matter who they are or where they live. We have all been newborns, and a health beginning is essential for a hopeful future. Statistics show that every $1 invested in maternal and newborn health is estimated to yield a return of between $9 to $20. And evidence also shows that spending on maternal and newborn health is an investment in human capital, not a cost, leading to economic development and happier, healthier societies. In Pakistan, mothers die every day, approximately 29 of them, from preventable and pregnancy-related complications. The country also faces high neonatal mortality, with over 670 newborns dying daily. Despite these challenges, progress has been made in recent years. For instance, the maternal mortality ratio has been reducing in the past decade, but not at a remarkable pace to meet the Sustainable Development Goal target. However, the neonatal mortality rate is one of the highest in the world. Accelerating progress in both maternal and newborn health is essential to deliver health for all. Even a single maternal or newborn death is one too many. We can end preventable maternal and newborn deaths. And on this World Health Day, WHO is calling for a worldwide reinvigoration of efforts to ensure access to high-quality care for women and babies, especially in the poorest countries and emergency settings where most maternal and newborn deaths occur. Beyond survival, critical investment is needed to improve women's longer-term health and well-being. Women everywhere need access to health providers who listen to their concerns and meet their needs, including in the months after birth when millions still lack critical support. Better maternal health means improving access to sexual and reproductive health services so that women can plan their lives and protect their health. Empowerment for women and girls is fundamental for tackling both maternal and newborn deaths. The World Health Organization will continue to partner with Pakistan and its people to deliver health for all, leaving no one behind. I hope this message encourages meaningful discussions on how we can work together to improve the health of mothers and newborns during this conference. I wish you a fruitful event, and I thank you once again for your dedication to deliver health for all.